Welcome to HPHA's Hip Replacement Surgery Pre-Admission Patient Education. The content was originally created by Vancouver Coastal Health and the Osteoarthritis Service Integration System and adapted by Grey Bruce Health Services. The Huron-Perth Healthcare Alliance would like to generously thank them for permitting us to reproduce the information used to create part of this learning module. Some of the information has been slightly adapted by HPHA. This education module is narrated. Please ensure that you have the volume turned up loud enough for you to hear comfortably. To pause the video, click on the pause button. To restart the video, click on the play button. You may find it helpful to follow along with your booklet as you review this module. If you have someone assisting you with care after your surgery, you may want to ask them to review this module with you. If your surgeon or healthcare team gives you different advice than what has been provided in this booklet, please follow the specific directions you receive. This education module will be divided into 4 sections. Number 1, hip replacement surgery. Number 2, before surgery. Number 3, during your hospital stay. Number 4, after surgery. Please review all 4 modules. Afterwards, you can go back and review the individual modules as many times as you like. Module 1, hip replacement surgery. This information can be found on page 6 of your handbook. Hip anatomy. The hip joint is a ball and socket joint made up of 2 bones. This allows your hip to move in many directions. The ball is the round head of the thigh bone, which is your femur. It moves in the socket of your pelvis, which is your acetabulum. There's a small elastic type tissue, which is cartilage, that covers the ball in the socket. This tissue protects the surfaces of these 2 bones. Muscles and ligaments support and strengthen the joint. In total hip replacement surgery, the surgeon replaces the diseased joint with an artificial joint, the prosthesis. Once the new joint is in place, the muscles and ligaments are repaired. This surgery typically takes less than 2 hours. Let's watch a quick video about hip replacement surgery.
During a total hip replacement, your surgeon will replace your hip joint with a prosthetic hip. The hip joint includes the ball-shaped head of the femur, which fits into the socket or acetabulum of the pelvis. Smooth articular cartilage covers the bony surfaces, cushioning the hip joint and allowing the parts to move easily. The most common cause of hip disability is osteoarthritis, a chronic disease in which articular cartilage wears away, resulting in severe hip pain and stiffness. When pain medication and other treatments are no longer effective, your surgeon will perform a total hip replacement. During the procedure, your surgeon will remove the damaged cartilage and bone and reshape the bony surfaces to fit the prosthesis or artificial joint. A cemented artificial hip joint includes a socket with a smooth liner and a stem topped with a ball that replaces the femoral head. Your surgeon will cement these prosthetic components into place. Then your surgeon will fit the new femoral head into the new socket. Before closing the incision, your surgeon will check the new joint's range of motion to ensure it functions properly. Over 90% of patients experience dramatic pain relief and improved hip function with a new joint that will last about 15 to 20 years.
There are no specific movement restrictions following your hip replacement surgery. It is best to avoid extremes of range of motion for the first 4 to 6 weeks. Pages 8 and 9 of your booklet outline some suggestions which may make moving easier and more comfortable.
My name is Nadina Walsh. I'm an occupational therapist with HPHA, and today I'm just going to review some strategies and some equipment on how to get up and down from a chair and how to get yourself dressed after surgery. To get up and down from a chair, one of the things that you will want to consider is the overall seat height of the chair. So when I'm standing against the chair, I'm going to want the height or the seat of the chair to come to at least my knee. The lower the seat height will make it more difficult to get up and down from the chair. So if it's too low, I can add a wedge or a cushion to raise the overall height of the chair to come closer to the level of my knee. The same thing would be considered for by your toilet. You can purchase or rent a raised toilet seat or a Versa mode which would both raise the seat height of the toilet and then offer armrests for the toilet as well. To move into sitting, what you're going to want to do is you're going to want to back up to the chair or to the toilet. You're going to want to bring out your operated leg first, reach back for the armrest of the chair, and then slowly lower yourself down. From there, you can push your hips to the back of the chair. To get up would be the same in the opposite direction, so you can slowly bring yourself to the front of the chair, bring your operated leg out first, and then push yourself straight up into a stand. To get yourself dressed, there's a variety of equipment that can help you get your lower half dressed if the way you did it before was a little bit more difficult still. So there's a variety of tools that have long handles or long ropes that do the bending and reaching for you. All of these are available at local medical vendors. This one here is called the dressing stick. It can help you to push your shoes off, push your socks off, or push your pants and underwear off. This is a reacher or a grabber. It has a trigger at one end and a clamp at the other end. When I pull the trigger, the clamp closes. I can use this to pick things up off the floor that may have fallen. And we can also use them to help pull your underwear and your pants on over your feet. The long-handled shoe horn can help you to put your shoes on. You can also use it to push your shoes off or push your socks off as well. And the sock aid helps you to put your socks on. So I'll show you how to use all this equipment. So from a seated position, I can use the dressing stick to push my shoe off and push my sock off. Or I can use the long-handled shoe horn to push my shoe off or push my sock off. I'm just going to use my reacher to move them out of the way. From here, when putting your underwear and your pants on, you're going to want to remember to dress your operated leg first. And I'm going to use the reacher. When putting your underwear on, you can grab all the way from the waistband through to the leg hole and then just clip that material on. With pants, it's a little bit too much material, so grab a hold of the waistband and then about a handful of material, clip it in, drop it down, throw it out in front of you, and then you can just slowly shimmy your pants up your foot. Generally, when it gets to your knee is when you can start reaching with your hand. Then you can dress your opposite side in the same manner. Grab a handful of material, squeeze the trigger, and then just work the pants up to about your knee. Okay, so from there, you're going to put your operated leg out, push yourself up into a tall stand, and you can pull your underwear and pants up. To take your pants off, bring them to about your thighs, bring your operated leg out, reach back for the armrest of the chair, slowly lower yourself down. From here I can use either the dressing stick or the reacher to push them down. And off. To put your socks on, you can use the sock aid. When using the sock aid, you want the heel of the sock to end up going to the bottom and the back of the device. So you can tuck the sock aid up against your tummy, push the sock on, or pull the sock on. You want it nice and tight at the end. From here, the long ropes are going to do the bending and reaching for me. Throw it out in front of me, and then I can just slowly pull it on over my foot. From here, I can use the reacher just to fix it and pull it up a little bit higher. So again, I have the sock aid tucked up against my stomach. The heel of the sock is going to go to the bottom and the back of the tool. I'm going to pull it on. You want to make sure that it's nice and snug at the end. If there's extra material here, there'll be extra material at your toes. From here, I can drop it down to the ground, slide my foot in, and then slowly pull on the ropes. And then I can use the reacher to help pull the sock up. To put my shoes on, one of the options for you if you have laced or tied shoes is elastic shoelaces. When you're sliding your foot in, the elastic shoelaces will expand. As your foot goes in, the elastics will retract. Or you can go to a Velcro style shoe as well. I pull the tongue back, I drop it down to the ground. From here, I can use my shoe horn to help me slide my foot in. Same thing with the other side. Just pull the tongue back a little bit. Drop it down to the ground. And then I can use the shoe horn to help guide my foot in. Thank you.
Module 1 Summary. Your surgeon has determined that hip replacement surgery may help you to have more movement and less pain in your hip. The surgery takes about 2 hours to perform. Pages 8 and 9 of your booklet outline some suggestions which may make moving easier and more comfortable.
That brings us to the end of Module 1. When you're ready, please review Modules 2, 3, and 4.